Zoom in, Zim. Most people who are on this particular COVID-19 page are curious to know what Zimbabweans are doing for Zimbabweans as it relates to COVID-19. So could you tell me a little bit about any contribution that you've made? When you heard that COVID is a pandemic, what was your response?
Well, to be honest, initially January, when we first heard about it, we were pretty much relaxed and we thought, it's a cold and it's going to affect old people and it's not going to affect babies, etc. February came and still a little bit more relaxed and, everybody was kind of saying, oh, shame, it's sad what's going on, but we're fine. And then a young man who I considered one of my sons as well, he'd gone to New York and he came back and he was tested positive and he didn't survive. And with his death came a huge wake-up call for everybody because he really was, at the forefront of so many initiatives. He was a leader in his age group. He really was a mentor even for a lot of people, and he was a role model for a lot of young people as well. So with the death of Zororo, it woke up everybody. In fact, it's almost like he was the martyr of COVID for Zimbabwe.
So it's been widely publicized how the medical facilities in Zimbabwe were ill-prepared for Zororo's treatment.
Yes.
And of course, we are all grief-stricken. I didn't know him personally, but any sort of loss of life that could have been prevented is obviously very upsetting for us all. What was your reaction to the state of our hospitals?
Well, it was clear that they were ill-equipped, that they really also, I think, got a shock at the severity of it, and they were not prepared. And with that in mind, using my network, I galvanized as many people as I could from, a cross-section, very broad, private sector, doctors, clinicians, IT people, financial gurus, pharmaceutical people, and we got together and brainstormed, and that's how we came up with a trust called the Solidarity Trust Zimbabwe initiative. And our main purpose at that time was to see how we could lobby the nuns of St. Anne's to reopen the hospital and use it as a COVID center. As you know, St. Anne's has been closed for about 7 years. So it was a concerted effort. We were very blessed that there were a couple of people within our group who knew the sisters, and so began the negotiation, and it's now going to be ready to be opened to the public, to everybody, and it will offer 100 beds as well as an ICU and an HDU. With that process going on, we then, within the group, we realized that the network was so fantastic and everybody was coming together in the most magnificent way. It's just been so humbling to see how Zimbabwean people, once they get together and they have a common purpose, it's fantastic. So with that happening, we then decided that in order to get it up and running, St. Anne's was going to require quite a bit of funding. We realized that we cannot do it alone. We need to partner with government. And with that in mind, we then got an MOU signed with the Ministry of Health. In doing that, it has opened up the possibility for us to also, as the trustees, take on about another 5 hospitals around the country, so that it's not just Harare. So we've got Bulawayo, as well as Yishavane, as well as Victoria Falls, Gweru, Mutare Infectious Disease Hospital. And there are other groups who've also come on board, and they've taken on some other hospitals as well. Right. So it's been quite a journey. And we have, within the group, a lady called Ethel Kuhuya, who is a data analyst and guru, and she created a platform for us to be able to hook onto the 2019 call center number, a hotline number, and it's the national hotline number that will be live. We'll be able to do triage. So if somebody calls the free hotline number, they can speak to a nurse. If they've got symptoms that have been escalated, they can then go onto a doctor. Right. From the doctor, if they need an ambulance or they need testing, they can go to them. That in itself will be amazing in order to get them to stay at home and not just rush to go to a center and possibly cross-contaminate or infect other people. So the hotline is going to be critical to making sure that we prevent the spread. Oh. So we've got a number of initiatives as SOTZIM, that's short for Solidarity Trust Zimbabwe, we are addressing for COVID.
And that's a really important point that you raise around, people not leaving home unnecessarily. And of course, for most people at the point that you think that you might have an illness as severe as COVID-19, your instinct is to want to go and have that checked out by a doctor. But then we as well live in quite communal societies. So that risk of cross-contamination is real, both at home and in a hospital. What are your thoughts around how our culture is set up to kind of drive some of these global initiatives we're seeing, such as isolation?
It's a huge challenge. I always say to people that in some of the European, countries where they're not as touchy-feely and huggy and kissy, or they don't have Muya and Sekuru and Muzukuru and, everybody living in the same house, it's not surprising that some of those countries have lower mortalities and lower, numbers. So in Zimbabwe, it is very difficult. And I think, thankfully, a lot of the population is Kumusha. And Kumusha, they will struggle more with the economic hardships, more than COVID, for example. However, in the cities, they have tried to make sure they practice the hand washing, and they practice, they're all trying to wear masks now and make them at home and try and pass the word on and educate each other. And the awareness needs to definitely be greater. So it's a challenge because, like I said, we live in communities where you can have, a lot of people in one place, in one home, actually.
Indeed. It's one thing to be in a house in Glen Launch, Isipiti, Mandara, where, you don't have neighbors to worry about. But it's another thing where your bread and butter is based on daily trade. I've got to go Kumusika. I've got to sell something in order to feed my family tonight. Whilst I appreciate that the trust cannot be all things to all people, what sort of thoughts or considerations, if any, have you made around funding and supporting families that are in absolute distress and who are left with the choice, would I rather die from hunger or from COVID?
So we do have a task force within the SOTZIM initiative, and that's the food drive. So apart from the frontline health workers, who we've had lots of donations and sponsorships from several companies who have come forward and said they're going to provide food, we've also said, look, we've got to try to galvanize as much support for the vulnerable. For example, people who live in with disabilities, the old age homes, the orphanages. So we've thought about it and said, if we were able to get food baskets, for example, and those could be distributed through the churches throughout the country, so that they have like a food pantry and people could then go to their church, register so that they're not doubling up or taking it to go and sell, for example, and come and get a food pack. There's a lot going on, not just within SOTZIM, but within lots of different groups in the country like CZI and Business Fighting COVID. There's loads of initiatives and people are trying, but it's tough. I mean, the latest statistic is that 8 million Zimbabweans will not have food, and that's really scary.
It's very encouraging to learn of all these initiatives that are taking place and to really see Zimbabweans both on ground and in the diaspora really coming together in a bid to make a difference back home. There's been endless call to actions. If everybody was to contribute $1, what a difference that would make.
Next week, we're hoping to start the SOTZIM funding campaign, and we're going to put it out to all the diaspora, as well as just lots of people who live on so many continents. There's Zimbabweans everywhere, and they are already reaching out and saying, what can I do? Even with the hotline, we've had nurses and doctors who are in the UK and in America saying, well, if you're going to operate 24 hours, I'm awake, I'm at home, I can handle some of the calls. It's been absolutely incredible.
So should I be a doctor in Milwaukee and I want to get involved, how do I reach out to you and how would I be able to sign up?
So you would go to www.sotzim.org.
Zoom in Zim, it's been a pleasure having you on. I look forward to seeing developments of all the great work that you're doing out there.
Fantastic. Thank you so much for the invite. It was a real pleasure speaking with you.
Likewise, Karen. You take care.